Well, I wanted to give you what I call late-breaking news on health reform. And of course, President Obama really wanted to get a bill out of Congress and on his desk in 2009, if nothing else, early 2010. And you know that it's been such a controversial issue, and there are new things popping up every day. I thought I'd give you a status report. Abortion is still a tremendous problem because there are members of the majority of the Democrats who want to put a ban on any payments for abortion into the health bill, and that would be a tremendous, let's call it, tightening up from the status quo. Now there are compromises on abortion, which is let's allow abortions to be funded from health insurance if you're covered for that, for rape, incest, and let's call it the health of the mother or the infant if there's a medical emergency. Women's groups are very upset about all this, and so that one is still a struggle, but I think they're going to find a compromise. The second one is, of course, the public option, which is the whole idea with the health care reform is that in many states people don't have any option, that there is one or two maybe insurance companies that provide health insurance for most people, and there's no competition, and that lack of competition drives up rates and prices and makes the companies be able to be less competitive. And the public option is supposed to be essentially a publicly funded or managed health insurance plan where you can choose between Wellmark, Blue Cross Blue Shield, or many of the others. In some states they have other companies, and a public health insurance plan. There are still a lot of Democrats, and including people like Joe Lieberman in the Senate, who used to be a Democrat and is now a kind of rogue independent, who say, no, I am not gonna vote for the government getting involved in running an insurance company. So the latest I heard just yesterday is that they are now talking about, the Obama administration is talking about perhaps talking with the big insurance companies and having the insurance companies run a second health insurance unit, which would be like a co-op or a nonprofit health insurance option, but it would be run by the existing private sector insurance, health insurance companies, but it would be essentially a nonprofit or a co-op system. Barack Obama did a very unusual thing yesterday. He went to Congress on a weekend. You know, those folks never work on weekends. They go home, they usually work on Tuesday through Thursday. That's the normal workday in Congress, but they stayed over the weekend. And President Obama went to them this weekend and talked with the Democrats about getting something out. And I think he is very flexible on this. Former President Bill Clinton actually said, my advice is work on it, find a compromise, and get a health care reform bill out, get it voted on, and get it on the president's desk. It really doesn't matter how many compromises you've got to make. Once there is a health reform legislation, then you can begin to improve it and fix it and do the things that you couldn't do while the debate was going on. You know, that's how the Constitution was written. Did you know that there were some things that were so controversial, the Constitution would never have been ratified and never left Philadelphia. So the founders said, let's leave those things and work on them after the Constitution has actually been ratified. That's how we get the Bill of Rights, you know, the first 10 amendments to the Constitution. Those were the things that they just could not get agreement on when they were actually writing the Constitution. But they added them on later, and the Constitution was, you know, sort of expanded after that. That's kind of the model for the new health reform bill. And I think my own view is that we will have some sort of health care reform legislation coming out early in 2010, and then we will have to work very hard to improve it and fix it. But we need something, and I think Obama and the Democrats are interested in doing that. The Republicans, on the other hand, have been very, very negative and have not really agreed to almost anything. And so they complained this weekend that Obama wasn't even talking to them. And I guess I would say to my friends in the Republican Party, if you are as belligerent as you've been and as obstructionist with President Obama as you've been, why would you expect him to come and talk to you, since there doesn't seem to be much to talk about? So it's going to be a pretty partisan health reform bill that's going to land on Obama's desk, and then we'll see where that goes. So good luck, folks, with your health insurance.